Hey, welcome back to the Sports Lodge here on AM 830. Want to continue with another edition of a brand new segment here in the Sports Lodge. We call it our Sports Lodge Health Tip of the Week, and it's brought to you by the City of Hope of Orange County, and you can check them out online at cityofhope.org/OC. They are doing amazing things over there, and today, an extremely important conversation as we will delve into breast health with City of Hope's Dr. Wade Smith. Dr. Smith, thank you so much for the time. How are you, sir?
I'm doing great, Roger. Thank you for having me on.
Hey, thanks for being here. And can we start with you maybe giving my audience a little bit about your path that led to not only your arrival at City of Hope, but your outstanding work there?
Yes, certainly. So I'm a medical oncologist that specializes in breast cancer, and I am with City of Hope at Newport Beach as part of the City of Hope, Orange County. And I see and treat all cancers and blood disorders, but primarily focus on breast cancer. That's my research interest, and that's the majority of patients I see. And so I saw this as a great opportunity to kind of weigh in on where our recommendations are with respect to patients getting screening and following up with their breast cancer treatment. My interest in breast cancer started in my training when I worked with a epidemiologist that followed families that carried a breast cancer gene, and that was right around the time when great new breast cancer drugs such as trastuzumab came out and really was a game changer in terms of helping patients with advanced breast cancer live longer.
Dr. Smith, the rate of breast cancer in Orange County is higher than the rest of the country. Do we know why?
That's a good question. We know it's 25% higher than the baseline and probably has a lot to do with the demographics of Orange County. We certainly know that certain lifestyle factors such as, body weight, reproductive lifestyle play into it, as well as ethnicity plays into it. So it has to do with the demographic makeup of Orange County.
And when you talk about the breast cancer patients that you work with, and right now they're probably and very understandably hesitant of entering hospitals during the coronavirus pandemic to continue their breast cancer screenings and their treatments. How safe should those patients feel in regards to entering your facilities at City of Hope?
Well, they should feel very safe. I mean, City of Hope has a long tradition of caring for patients who have very weakened immune systems. Historically we've been centered around, for instance, bone marrow transplants. So we're very careful in the measures we implement. And for instance, at City of Hope in Newport Beach, we place emphasis on everything from the cleaning of the facility that we do regularly. We do temperature screening at the door. We question patients as they come in, making sure they don't have any concerning symptoms that have developed during the interim. And, we do everything from spacing out appointments to ensuring that patients and staff alike are wearing, protective equipment. So we're doing everything across the board to make it a safe experience for the patients.
How often do you recommend to your patients that they should be screened?
So really, as a rule, annually. Once a year, I recommend annual mammography starting at 40 for patients. And I think every woman at age 25 should have a risk assessment that takes into account family history and other factors that may put her at a higher than average risk of breast cancer.
And how much does family history play into this?
It plays quite a bit, particularly if we can identify a inherited mutation that can increase one's lifetime risk of breast cancer up to 60% or higher. So very important.
This is our Sports Lodge Health Tip of the Week presented by City of Hope, Orange County, and we're talking to Dr. Wade Smith, who specializes in breast cancer at City of Hope. You can learn more at cityofhope.org/OC. Dr. Smith, can we men get breast cancer?
Certainly can. Even though representing about 1% of all breast cancers, men certainly should be aware of their risk. And if a man discovers any abnormality within his breast chest wall, a new lump, he should seek attention right away. Absolutely.
And doctor, how can women prevent breast cancer? Is there any way whatsoever?
Well, there are certainly some lifestyle modifications. We encourage women to maintain a healthy body weight, particularly postmenopause women. We find that that does have a correlation with risk for developing breast cancer. But most importantly is screening. The best thing a woman can do is maintain her breast cancer screening. As I mentioned, on average, it's a once-a-year mammogram. It may involve additional imaging than that. And certainly we encourage self-examination once a month for women who are comfortable doing that.
Hey, the City of Hope just opened a brand new, amazing state-of-the-art facility in Newport Beach back in January. What services are offered there in Newport?
So we're really excited about this build-out, and we offer medical oncology, which is again treating cancers. We offer surgical oncology, which is utilizing surgery to treat cancers, and we have excellent infusion services as well for providing cancer treatments that are state-of-the-art.
And how would you best describe City of Hope's overall vision for its place in the community and their message out there right now?
Well, what we're bringing is cancer care that's really cancer-specific to a patient's individual cancer that they're presenting to us with, be it lung cancer or breast cancer or colon cancer. We have cancer specialists who focus in these areas, and we also have as well access to state-of-the-art trials, both early and late-stage trials.
And one more time, the message for women out there, screened once a year, and the health is very, very important, correct?
Yes, health is very important, and even during this era of COVID-19, it's just very important to stay on top of following up with your screening appointments as well as treatment follow-up appointments if you are somebody that's been diagnosed and under treatment for cancer.
What's your message to your patients in regards to wearing a mask during these difficult times?
We certainly recommend taking appropriate precautions, including stay-at-home measures as well as when in public, wearing masks, particularly where social distancing becomes a challenge.
Dr. Smith, how old were you when you first had a conversation with someone and you told them, I'm going to be a doctor, that's how I'm going to make my living?
Oh, that would have been, I think, late in high school, probably senior year of high school.
And was there something that led to that decision?
Yeah, I've always had a interest and fascination in health sciences and have a family member who's an interventional radiologist. And I saw that there were great opportunities within both surgery and medicine to pursue a career.
Fantastic. It's our Sports Lodge Health Tip of the Week presented by City of Hope, Orange County. Dr. Wade Smith, who specializes in breast cancer at City of Hope. You can learn more at cityofhope.org/OC. Dr. Smith, truly appreciate your time, and thanks for checking in for our Sports Lodge Health Tip of the Week, my friend. Thank you.
Thank you, Roger, for having me on.
Thanks for being here. That is Dr. Wade Smith with our Sports Lodge Health Tip of the Week presented by City of Hope, Orange County. Check him out online at cityofhope.org/OC.